Well, hey guys, this is Sherman from Sherman Live. We have Michelle Brown from Reclaimed Health Group, Health and Wellness. We have the queen of registered massage therapists and RMTs in Chilliwack on the podcast show with us. So, Michelle, I know that let's talk about some exciting news first. You're excited about what's coming up in 3 days.
Yes, my trip to Mexico. I'm very excited for a vacation.
Yes,
It's about
long
time.
awaited relaxation, and I know you guys go hard. So tell me more about what's going on with ICBC. There's a new ruling.
Yeah, definitely. So I just wanted to kind of inform our patients about the changes in ICBC treatments, because prior to April 1st, 2019, our patients found it sometimes difficult to have access to treatment when it came to ICBC treatment. The problem was that a lot of RMTs wouldn't direct bill to ICBC, so our patients were paying out of pocket for their treatments, and it makes accessibility to their care a little bit more difficult. So with this new ruling, ICBC now is making it easier for therapists and our patients to access that care. So prior to April 1st, ICBC was only paying about $23 a treatment. So regardless of if it was a 30-minute treatment, a 45-minute treatment, 60-minute treatment, they didn't base it on the need of the patient. Instead, they were just basing it on kind of a flat rate for all treatments. And for most RMTs, it's difficult to then bill out for $23 and then try and chase ICBC for their money. And then also for our patients then to be having to pay out of pocket instead of us being able to direct bill. The other big change and the big difference between prior to April 1st of this year till after April 1st is that ICBC was not the first payer of these claims. So often what our patients would have to do is they would have to go to their third-party insurance, so Pacific Blue Cross, Medivy, Green Shield, whoever it is, and they'd have to max their benefits out before ICBC would then pay for those benefits to get the massage therapy treatments that they needed. So there was always this disconnect between the third-party insurers, ICBC, and then our patients were kind of caught in the middle of this struggle between them. Mm-hmm. So now what's happening is ICBC is going to be the first payer. So we can direct bill to ICBC, and then if there is a remaining portion after and above what ICBC is paying, then we can direct bill that to their third-party providers. So that makes accessibility to care a lot easier for our patients. Okay. It means that they're getting treatment sooner, more frequently, if they need it. A lot of people, even though they needed treatment, say twice a week after a car accident, they weren't coming in that often because it was hard on their paycheck, right? It was hard to pay for that many treatments, especially if they're getting multiple treatments. So if they're getting physiotherapy, massage therapy, chiropractic care, all at the same time, all in the same week, and they're having to pay out of pocket, nobody can afford that, right? Mm-hmm. So one of the changes is that ICBC will now charge, or they'll pay out for an initial consultation with a massage therapist. So your initial consultation can be up to 60 minutes long, and it's 100% covered, and 100% we can direct bill to ICBC, so nothing out of your pocket, which is fantastic. And then after that, ICBC will provide patients with 11 treatments at 45 minutes a treatment, which is enough time for assessment and hands-on care in a treatment. And typically, if you're experiencing, one or two areas of the body, that's enough time to treat those areas. Another great thing about this change is that it's regardless of fault of accident.
Okay.
So if you're at fault for the accident, you can still receive treatments, up to 12 of them after the accident. So you don't have to wait till fault is, determined.
Determined, yeah.
Yeah, so you don't have to wait until that's determined before you can actually receive treatments if you're injured, which, as we all know with research, the sooner people, especially with whiplash conditions, the sooner you can be treated after the accident, the better your outcome is. Okay. So we recommend usually within 72 hours of your car accident to come in and get assessed and start your treatments and develop a treatment plan for you. Another great, yeah.
Sorry, I don't want to interrupt. Go ahead.
No, go ahead. Go ahead.
Have there been situations or cases where treatment care recommendations are in conflict with what a physio might say or versus what an RMT says? Or
sometimes, like, we definitely have to work with the physios because we don't want our patients being overtreated. So it's really important that we know what the physio is doing, that they know what the massage therapist is doing, so that we're not doing overlapping treatments, say in the same week or on the same day. So oftentimes we'll communicate with our patient's permission with their other care providers so that we know, okay, like with Carrie from Chilliwack Sports Medicine, often we'll figure out, okay, Carrie's going to do some needling on the area. It's a good idea to have the needling prior to coming in for a massage.
Okay.
So you want to have needling first, and then either that day or the day after, that's when you want to come in for the massage. So we'll coordinate our treatments so that it's more effective for our patients. And again, so they're not being treated. And that is also dependent on the stage of their injury as well. So if somebody comes in and they're really acute, the accident's just happened, it's within that 72 hours, they're going to be treated a lot different than when they're in a subacute or a chronic state of their injury, right? So that all has to be determined through an assessment. And then, yes, collaborating with their other primary care providers is really important to make sure the treatments are effective and not too much for them. Yeah.
Okay.
And some of the other big changes as well is that our patients don't have to get approval from their ICBC provider or their doctor prior to getting treatments, which is huge.
That's
so
massive.
Our doctors are bombarded with soft tissue complaints. It's one of the primary reasons why people go on WorkSafe claims or come in after ICBC, like with their ICBC claims. And our doctors are so busy. How often do we try and get into a walk-in clinic, or we try to get into our family doctor and it takes weeks to get into? So now our patients are able to get that care quicker and when they need it more, and they don't have to wait to get into their doctor. They don't have to wait to see their ICBC adjuster. Those treatments can start immediately. So within those first 12 weeks after their accident, they can have those 12 appointments without any approval.
Okay.
And then if they require more treatment, so if it's determined that maybe this is going to be a longer term care or they need some extra help, then we can go and get a doctor's referral for extended treatments. We can talk to their ICBC adjuster and they can get more treatments as needed type thing.
Michelle, the 12 is shared between all care providers. Correct?
No.
It's 12 per discipline or 12 per care.
It's not even per discipline. It's different for each discipline. So for massage therapy, it's 12 visits within 12 weeks without a referral, without approval.
Okay.
I think physiotherapist, I'm not 100% sure on the number, but I think it's 25 treatments.
Okay. So let's say a dozen with RMT, let's say 25 with physio.
Yeah.
And okay, that's great.
Yeah,
okay.
Exactly. And that's without any approval from, so, again, it's really hard to get into a massage therapist too. Sometimes you have to wait a little while. So it's good that our patients know that you get in a car accident, you have soft tissue injuries, you get out of the hospital, you've been assessed, everything with your bones and x-rays and everything like that is okay, but you're still having headaches, you're still having whiplash pain, your shoulders, your hips, a lot of low back and hip issues from car accidents. It's good to know that you don't have to wait. You can call your massage therapist. You can book in those appointments.
Yeah.
And get the care that you need right away.
That's incredible.
Yeah.
That's incredible. What do you foresee outside of what you've covered would be some of the frequently asked questions by clients, patients, and new patients?
Are we just talking in general or in regards to ICBC? Because in general, I've got lots of them.
Correct, right. But specifically this new ruling, they get into an accident, anything that you maybe haven't covered yet, you think that I'm going to ask?
Definitely. One of the important things to note is just like with any accident, you're probably going to call ICBC right away to report the accident. And what's going to happen is they're going to give you a claim number. And that claim number is what we need to be able to direct bill for our patients. So it's really important that they have their claim number and that they have all the information about their accident, because we do have to ask very specific questions when we're dealing with an ICBC case. And that's part of our initial assessment we would have with our patients. It's a very thorough assessment. There's lots of things we have to cover. So making sure you have all your medications that you're on, any recommendations from the hospital if you were seen in a hospital, any kind of x-rays. If you did have x-rays, those are great to have. And then also you definitely have to have the claim number as well, so we can direct bill and everything for them.
Okay. So as soon as April 1st kicks in or comes around, that ruling is in effect.
Yeah. And we're going to have new treatments on our website that will be specific for ICBC claims. So right now, somebody who has an ICBC claim, they would just note that in their intake form. But now we're going to have an assessment treatment for our patients that they will then book themselves if they would like to online, or when they call in, make sure they tell us that they have an open ICBC claim, and that we can then give them the appropriate treatment and book them in. And then we'll have a subsequent treatment plan set up for them. So on our website, there'll be a secondary follow-up treatment for them that will be 45 minutes long.
Okay.
Yeah. Okay. And we do recommend pre-booking appointments. So everybody gets very busy. So usually what I'll say is pre-book at least your first 2 or 3 appointments, at least 3 days in between those appointments, but pre-book a couple appointments so that we can get you into a good rhythm with them. With our initial assessment, what I like to do is after the initial assessment, I'll wait till their second treatment before I develop a treatment and management plan for their care. So I'd like to know after their treatment, how they felt after their treatment, how long the effect of the massage lasted. Were you really sore? Was it maybe too aggressive with their treatment? And then I won't know that till the second treatment that I see them. And then I can say, okay, I think you need to come in twice a week for the next 3 to 4 weeks. And then I want to try spreading those treatments out. Or I don't need to see you. I only need to see you once a week for the next couple weeks, right? So it's hard to determine that until we've done the assessment, we've done an initial treatment, and then we do a follow-up treatment. So I always recommend at least booking those 2 appointments right when they book their first one.
Because I know you guys book up really quickly.
Yes.
What for folks who are seeing or getting to know you guys for the first time, what's an easy way for them to pre-book with you?
Definitely our website is probably the fastest, easiest, and most convenient way to book. You can do it at midnight if you'd like to, or you can do it when we're closed at least. You don't have to talk to somebody on the phone or wait for us to answer our emails. So that's why we'll have it set up on our website to make it really easy to see, okay, I have an ICBC claim. This is the massage we should be booking.
Okay, that's wonderful. Any last points that you want to cover on this topic, Michelle?
No, I think that's it. Yeah.
You've been quite comprehensive with timing, specifics and details about it.
Yeah, I think mainly just being aware that you want to be talking to your therapist about the ICBC claim, that you do have an ICBC claim, being open about that when they call in, making sure that we know that's what we'll be dealing with so that we can set up everything for them prior to them coming in is really important.
Yeah, that's awesome. That's great info. And I think it's going to be a wonderful win-win for not only the practitioners, but also the people seeking help.
Absolutely.
And I believe it definitely be a win for ICBC too.
Yeah,
with,
I think so.
Patients or clients feeling better. So Michelle, thank you so much. That's great. And we'll definitely have this podcast on your website, and the details for pre-bookings also on the website, reclaimedhealthgroup.com. Once again, we have Michelle Brown, clinic manager and RMT at Reclaimed Health Group, and the website is reclaimedhealthgroup.com. And I know after this, she'll be enjoying her time in Mexico.
Can't wait.
And we'll catch you up on the next podcast episode.